my name is Erin Dempster, and I am the owner of Autism and Behavior Resources here in Danville. And I am a board-certified behavior analyst that has a passion for advocating for the community and creating community events. And one of the new things that I have started doing is interviewing people in the community to learn about research projects, events, and their involvement in the community. So I'm very lucky today to have Casey Pegg with us. He is from the Pennsylvania Health Access Network, and he is going to tell us a little bit about the project that he is working on, his background, and how you can get in touch with him. So thank you for joining us today.
Thanks so much for having me.
So do you want to talk about your background and where you went to school and how you got involved with the Health Access Network?
Sure. So I went to school at the University of Pittsburgh for my undergrad in philosophy and psychology, and I also have a master's degree in religious studies from the University of Kent. I kind of went down the community organizing path because I really started out in the environmental justice movement.
Okay.
And I've also done community organizing around racial justice and economic justice. And I moved to Central PA to get involved in some of those things, and I happened to just fall into the PA Health Access Network.
Okay.
I don't really have a healthcare background, but
Okay.
I have worked as a TSS and a therapeutic support and a teaching assistant.
Okay.
Yeah.
Great. Casey and I met at Starbucks when he started this project, and I was super passionate about everything, and I think I scared you the first day. Did I scare you a little bit? I was
pleasantly overwhelmed.
I threw out a lot of acronyms to him. There's a lot of stuff to know in the special needs world that can definitely be confusing, so getting involved is definitely needed in the community. Can you tell us a little bit about the project that you're working on?
Absolutely. So the project I'm working on through the PA Health Access Network is called the Rural Healthcare Access Project, and its intention is to improve healthcare access for people with disabilities in rural central Pennsylvania.
Okay.
So it's operating in 9 counties with some wiggle room to go outside of that territory. The 9 counties are Schuylkill, Columbia, Northumberland, Montour, Union, Snyder, Mifflin, Juniata, and Perry, and I've also been doing some work in Lycoming and Luzerne counties.
Okay. So Williamsport families, I know I had a lot of Williamsport families that just joined. You're more than welcome to get in contact with Casey at the end if you have any questions.
Absolutely.
So when you started the project, you learned about the different needs in the community. What is the ultimate purpose of the project, and where is it supposed to go in the future?
The ultimate purpose of the project is really to promote self-advocacy. It's to support people becoming leaders in their community, increasing people's comfort levels with engaging with their providers and with healthcare organizations to get needed change. So the overall arc of the project is what I've been doing for the past 6 months is collecting stories to understand the issues from the inside out.
Okay.
And what I've been doing more recently is following up with the people who shared their stories and twisting their arm to join county level teams. Like Erin, for example, we just had a meeting at her house a couple weeks ago. And those teams are really the anchor point for each of the counties to work on evaluating the healthcare system in those areas, coming up with recommendations, and focus on advocacy to make the needed changes.
What are you hearing from families, from providers that struggles within the Central PA community are?
So I think really the top 3 issues, let's start with the top issue. The top issue I think is communication from providers. A lot of providers, it doesn't seem like they have a lot of disability competency.
And that's anywhere from ENTs to gastro to primary care to anybody working with kids with autism, all over communication.
Yeah, and I'm not going to say that communication is bad universally, because of course people report a lot of good too. I think for every person that says that they have a problem with a healthcare provider, there's at least one person who said, oh, I have a really good doctor, or I have a really good dentist. But of course we want it to not happen at all. And so across the board of all those fields that you just mentioned, there has been a lot of reports of people having issues, either just not understanding a person's needs, not taking the time to listen, in some cases even being prejudiced or dismissive or even not valuing the individual's lives.
Right.
So that's really the number one issue that's been reported.
Okay.
And then I would say other issues which have come up are provider shortages.
Absolutely.
So, and then that kind of manifests as really long wait lists, especially related to dentists and psychiatrists, but also general practitioners and other healthcare workers. And beyond that, transportation is another huge issue, and that's something that, of course, is even more acute in the rural areas where we are.
Absolutely. And I know something that we have been talking about through my page, if you've been following, or in any of the provider or parent pages, is that being able to speak up when these issues are happening is really hard. It can put an uncomfortable situation between you and the doctor and then the care for the child in the future. So with Casey doing this project, if you do have concerns, speaking out to Casey is a great opportunity to get your voice heard to hopefully make change in the future.
Yeah, and you can participate to whatever your comfort level is. If you don't feel comfortable doing the advocacy like I was talking about, just hearing your story is still helpful, because then we have more documentation of the issues that are going on. So
let's talk about the steps in the process. So right now you have this interviewing process, you're interviewing people, you've gathered some of the data, but you're always looking for more data. And after you gather the data, you're going to make little teams in the counties, correct? And then what's going to happen from there?
What's going to happen from there is the teams will actually go out to provider sites and do evaluations of how accessible each place is. And we're still in the process of deciding how that's going to look, but basically what it'll be like, we'll call up a doctor's office, let's say, and say, hey, can we come out and evaluate you? We want to help you get better, and we want to document the things that you're already doing well so that other providers can get better too. So then we'll go out there, we'll look at physical things like parking accessibility, bathrooms, hallways, doors, things like that. We'll look at the training level of the staff and whether they have the right equipment. And we also really want to hear from providers things that have thrown them for a loop. I think that's one of the major things that come out of the CLT meetings, because we understand that the providers are doing their best, and we want to know what they need help with, what they see as problems, steps that they may already have taken to remedy some of the issues.
I know we have in our Central PA region, we have a great group of providers and parents that are strong advocates for their children or the individuals that they work with. So I feel like these group of people could be great for the providers to get training, to get resources that they might not have.
Absolutely.
So after they do the evaluations, then what's the step after that?
After the evaluations are complete, well, I mean, so these processes are all going to be kind of going on simultaneously, but when we get enough evaluations that we have a good picture, we're going to create a list of recommendations and then bring those recommendations back to the providers and the healthcare organizations and do whatever needs to be done to fix that. And that could be developing trainings. We had talked about maybe getting some legislation, maybe getting some like mandatory ongoing education credits. I don't want to tip my hand too much because all this is still, theoretical at this point, but that's kind of what we've been talking about.
But if you are a parent or provider and you do have some ideas, things that could be helping the community, please reach out to Casey. And we are willing to take any ideas and suggestions, because this is definitely a community project. It's just not one person doing it. It takes a lot of work to make change. And I think having community together is definitely going to be helpful.
Yeah, thank you for emphasizing that. This project is really driven by the participants. I'm really just there to support people and keep things moving, but it's really all of you folks who are going to be doing the work and getting things done. So
how can people get involved?
Well, can you post my contact info?
Yep, I'll post my contact information in there. And what counties are you still looking really for people? I know we have a lot in like the Lewisburg area, Montour County, Union County, but what other counties are you really struggling on getting families? And if people online maybe have contacts, we can reach out to them.
Yeah, I'm trying to find people in Mifflin, Juniata, and Perry counties in particular. I haven't connected with too many folks out there yet, but I will talk to anyone.
Yeah.
And we can always use more people. So no matter what county you're in, feel free to reach out.
Okay. And I know this is Autism and Behavior Resources, and I just don't share information about autism. So if your child is in a wheelchair, hearing impaired, what are some other things that people have reached out to? If they have vision problems, they might have gastro things, anybody can reach out. It's just not autism. It is the entire spectrum of special needs. So if you have concerns, please reach out to Casey, and we would be willing to hear your story and bring you together so we can collaborate. And I think something that is also nice about the project is that it's bringing people together that might not have connected before. So meeting new people, meeting new friends to advocate together.
Yeah, it's really great in some of these meetings when one person will ask a question and someone else will say, oh, I know about the resource and stuff. That's really what makes it so magical.
Yeah, it does. So thank you guys so much for watching. If you have any questions, please reach out. I will put Casey's contact information in the comments below, and I have shared his flyer on my page before, but just to recap, Juniata County, Mifflin County, and Perry County. Those are the three that we're really looking for people. So if you guys can reach out to your friends and families in those regions, that would be really helpful. And we will be back next week with another interview. And if you guys have any questions in the meantime, please reach out. Have a good day, everyone.